Hello, this is our capstone project about burnout and emergency department nursing for the University of Cincinnati Scholarly Showcase. We are your hosts, Sami, Drago, and Alyssa Wiedemann.
So the reason why we looked at burnout in emergency department nursing is because burnout is very prevalent and is a hardship nurses face throughout their career. This can lead to worsening patient outcomes, nurses leaving the bedside, difficulty separating work life from home life, and a variety of other problems that can occur. As nursing students, we have observed nurses dealing with burnout, and we were able to recognize and notice signs of burnout. And we realized that understanding that burnout can affect anyone in the field, and it should be a priority to face it head on to keep nurses at the bedside and taking care of the patients the best that they can.
So what needs to be done? By these observations, it is noted that nurses in the emergency room lack understanding of how to cope with burnout and ways that they can recognize it and maybe experiencing it. The question then we asked is if emergency room nurses at University of Cincinnati Medical Center who receive education about burnout compared to nurses who do not receive education have a higher perceived ability to identify and cope with feelings of burnout.
We presented our presentation at the University of Cincinnati Medical Center. For our presentation, we assessed what burnout is, how to identify signs of burnout, hospital resources, and individual ways to prevent burnout. To start the presentation, we gave a pre-test and we ended the presentation with a post-test survey, and this assessed the knowledge level that nurses presented. The data was then collected and analyzed to show whether the presentation increased the nurses' level of understanding of burnout in the emergency room nursing.
How often are symptoms of burnout felt? One of the most important questions we asked was in a span of 2 weeks, how many times do you feel symptoms of burnout? And 60% of nurses said that they felt symptoms of burnout 3 to 5 times. And this is very concerning due to the fact that having burnout can decrease your job satisfaction and can affect your work performance. So this can put patients at risk with medication errors, not paying attention, and just overall patient satisfaction rates.
Another question we asked are how interested are nurses with learning more about burnout? From our presentation, we realized that majority of the nurses either agree or strongly agree about wanting to learn more about ways to prevent burnout. And this is a great response because it allows us as the presenters to see that nurses are dedicated to increase their knowledge about burnout. And this can hopefully lead to a decrease in burnout and just overall more dedication to preventing burnout in the nursing field.
For our post-test, we asked if the nurses felt like they could provide 3 coping techniques to prevent burnout to a coworker. And 93.3% of nurses said they could, which is great because education is imperative to nurses combating burnout and preventing it in the future. So this education that we performed was effective in answering if providing information is useful. And if hospitals provided education more than we did, it can be very useful in helping the prevention of burnout and really supporting their nurses if they do experience burnout.
So our call to action is to hospitals to hopefully acknowledge the lack of education surrounding burnout and the issues it causes with their staff. Until more nurses are aware of how to prevent and cope with burnout, there will continue to be a shortage of bedside nurses who are not willing to put unsafe work environments and abuse over their mental health. Burnout education and resources should be a requirement in all hospitals, not something nurses should have to fight for. Nurses advocate for their patients every single day and every single shift, and we feel that hospitals should also advocate for their nurses' mental health and to help prevent burnout amongst nurses altogether.
And here are our resources. Thank you so much.
Thank you.